Hey YouTube, before we jump into the video, make sure you check out my Patreon account. It's designed for serious medical aesthetics providers just like you. Oh, thanks for joining me. I really appreciate this, man. I'm a big
patiently
fan.
in line. It's a really nice invitation. I'm looking forward to speaking with you.
Just wanted to start off with your book. Man, this is a great book. So a lot of my followers are other providers throughout the world, other injectors, and they're always asking me for, one specific textbook that's related to aesthetics medicine and injections. And this is the one I always bring them to because for me, I mean, that's what we're really going to get into today is just basically, what it takes in order to be a competent provider and be successful in this field. For me, a lot of it was some self-learning and whatnot, but, which means a lot of PubMed research and whatnot just to get down to the nitty-gritty and anatomy. And you laid it out beautifully in this book, and the illustrations are amazing, very easy to read. I'm a huge fan.
Thank you.
Great job.
It was always something which I planned to do, Dan, and I'd always write little notes and references when I was traveling, sort of on a train or a plane, and I pretty much put it all together in lockdown. So that was my lockdown baby, and I wanted it to be something which was... it could be easily digested because anatomy can be a little bit sort of daunting for some people who don't understand the sort of the concepts of cadavers and those type of things. So I tried to make it as simple as possible. And there's a saying, I think it was Einstein, if you don't understand it well enough, you can't simplify it. And that's what I tried to do, simplify it.
Absolutely. I'm a huge believer in that. And that's actually what I try and do. It's weird because I actually started off opposite. Most people started off on social media doing like Instagram. And then after that, they may branch out here and there. But I started off on YouTube and I knew that there was a little bit of a niche there. And I found the exact same thing. I felt like, this field, for some reason, it's either, you got to dig deep and you got to figure your way out, but no one's really just illustrated easily, the levels of SMAS, different levels of, there's the fat pads and what they do. And at that point, I figured, I can explain this pretty simply. And if I can do that, not only would people grasp it better, but at the same time, it's really like I'm teaching myself. Like really, if I can teach it at that point, then it's going to be like ingrained here. So
I think the more you teach, Dan, the more you learn. And I think that's where I found over my career. You're going to have to do a lot of self-directed learning, and you've got to make sure that you've got not just quality education, but a quantity of it, because you can burn your fuse pretty quickly with saying the same things time and time again. So for me, self-directed learning and reinvention of myself was the key to sort of part of the longevity I've had.
Yeah, I agree. And in this field, it's pretty interesting, right? Because I find that, with different routes of medicine, most of everything you learn is evidence-based. And then all of a sudden you get into this field and you're kind of like, I'm listening to this guru who's kind of saying something, you're like, I believe him wholeheartedly, but at the same time, you're like, does that really actually do that? And it's funny because you've got people like Subio who are just basically calling him out. It's really interesting. And it gives you a perspective of, right? This is still medicine. We need to be, we have to treat it like medicine. And really, the nitty gritty is anatomy. Like, if you can understand the anatomy and understand, like, as much as you can, then it's going to make you not only a better provider, a safer injector, but at the same time, you're going to have so much more confidence whenever it's time to do the work.
I agree. For many years, we didn't run with the evidence base. It was there always in plain sight for us. And we decided to choose eminence, like you said, over eminence. And I think this was part of the problem. It was a case of bad drivers teaching bad drivers how to drive badly. And everybody was bumping into each other. And when we stepped back to the evidence base, then things became a little bit more lucid, a lot clearer and transparent to us. And as I said, that information has always been there. It's whether we choose to use that information or not. And I'm an evidence-based practitioner. Although the evidence isn't as high as we'd like it to be, it's there and it should be utilized to our advantage.
So my question to you is, are you still practicing as an aesthetic dental surgeon?
I put my tools down quite a few years ago now and sort of moved over to the dark side, which was you're always classed as a little bit of a maverick, a little bit left field if you move away from your vocation in which you made your career from. But this, for me, was just an alternative sort of sidestep because I had the prerequisite sort of skill set and core knowledge to move over quite easily, because dental surgeons are used to injecting the face pretty much every day with a needle in their hand, and they understand the difference between hard and soft tissue. So for me, it was a sensible sideward step.
Okay, interesting. So, and that's a great segue for the question here. So a lot of providers will send me questions saying, how long does it really take until I'm going to get comfortable? When should I actually start injecting the face? Like, should I be just mastering anatomy? Should I spend my time in books and online courses and practicing for months and months before I actually start injecting? And should I start injecting with like Botox only, or should I just jump in? What's the answer? For me, that question is, it's going to be different for everyone. You can have someone who's very comfortable with a background like yours, who has a strong anatomy background with the face, or you're coming with someone who's, maybe a registered practical nurse or an LPN or whatever the term is in different parts of the world, but almost no anatomy background of the face, and you're starting from zero. So what are your thoughts on that?
I think it's difficult, and as you said, everybody's a different learner of different sorts. So some people are very visual, others are auditory, some are kinesthetic, and you have people like myself who are pretty much all of those things. I would say the key here is patience. Patience, number one. People are scared of the process. They like the success, but they don't want to go through the process of this a classic Dunning-Kruger curve where you learn very quickly, you reach the top of Mount Stupid, drop right down to the bottom, and then continue your career in a slow trajectory. And I think that's the key here. It's don't try to rush too far. Don't do a beginner's course 1 week and then next week you do an advanced. It doesn't work like that. You will reach the top of Mount Stupid pretty quickly. Also, you can do all the self-directed learning that you want in terms of putting your head inside a book. But my advice is to get a mentor and to find someone who can help you develop and has the time and the patience to help and assist you throughout your career. 1 day with a mentor is better than 1,000 days with a book.
Yeah, absolutely. So for you, for example, whenever you got into medical aesthetics, whenever you went to the dark side, what did it take for you to become comfortable? Was it a combination of courses, seminars? Was it more self-directed learning? And is that the reason why you ended up creating this education platform?
I think like most people who were injecting in the generation where I started over 20 years ago now, Dan, there was really nothing much there. So there was no real courses or support, or the fact that we didn't know what hyaluronidase was at that time, that tells you everything. So pretty much I made every mistake you could make during the first few years of the career, but I learned from that, and that's what I think an expert should be defined as: somebody who's made every mistake and then learned from it, and then they have the ability to pass that knowledge down through the sort of the generations that we see. So I learned on the job, which sounds pretty horrific in terms of where we are today, but that's all we had.
What do you think about Cadaver Labs? So obviously you're going to be a fan of them, but do you have anything specific that, a benefit of someone who's just getting into medical aesthetics, learning at Cadaver Lab, versus someone who's well into medical aesthetics, still going to train on Cadaver Labs? Do you think there's a benefit there? What do you think?
I think there's a bit for both people, both your sort of novice and your advanced injector, because you can do things like inject, dissect. So you can actually try your injection sort of strategies before you go off into real life and inject within your office, within your clinic. I always think that understanding three-dimensional anatomy, and if there's many cadavers, you can look at the variation between that. So I always say distribution is never going to help you in medical aesthetics. It's always the depth. So I think cadavers are very, very useful. But I think that how we train, it's the opposite way around. So we train with lips and nasolabial folds, and they're the most two occluded areas we have, and we tend to train straight line injections with needle. Again, I think we need to go anatomy, complications management, put them together, and then move through the injection protocol for areas of risk. That's the other thing that I think that most companies should be doing now. They should be training areas of risk, not the areas where people are expecting treatment or requesting treatment. We have to put the horse before the cart.
Yeah, there was one of my YouTube posts I did recently. I talked about, most of the time, actually it's still like that. Basically, whenever you take any introductory course, they get you involved in, it's always with a needle instead of a cannula. And they feel that because of your medical background, you're used to using a needle, we should get you started off with that, and then later on get you into a cannula. How do you feel about that? Do you think that, right off the bat, we should be using cannula?
100%. You've got one entry point, you've got multiple surface areas. And again, this was always reserved back in the day for advanced injectors. I don't get it. I think the advanced injector knows how to use a needle better, but a cannula is key to mitigating risk, and you can cover large surface areas with a low risk sort of pattern. So I think that the first thing you should pick up is a cannula.
I agree. I think that you get more feel with the cannula. I don't really know how deep I am with a needle. I'm sure I'm in the right plane if I'm all the way on the bone, but you just get more feel with it. And we're humans, like we're intelligent beings. It's as if we're treating us like we're toddlers and we don't know the difference between anything. And for us to start with the cannula is, I think everyone should be using a cannula. I think that it gives you much more feel. I think that you're going to understand different layers of the face a little bit better, and you're going to be a lot safer. I find it really, interesting how, particularly the mid-cheek, right where the infraorbital artery is, you're just going to go straight in with a needle to, how often are we filling the mid-cheek? Almost all the time. How often are you filling, the nasolabial folds? We know that arteries running parallel with that, and new people are training with needles, and it's, for me, I'm a huge advocate for cannulas. A, they're not only safer, but B, clients are much happier with them because they're not bruising as much. And I know that if I try and use a 25 gauge cannula for almost everything, it's extremely rare that I'm going to use anything else. I may vary like the length, but that's about it. I know there's certain, studies about potentially even a 25 gauge cannula can penetrate an artery, possibly, but at the same time, it's so rare. And as long as you keep that cannula moving, my gosh, like you're safe. So I try and get everyone to get into cannulas as soon as
the
possible.
evidence behind that, Dan. You've got 1 in 6,410 for a needle, 1 in 40,000 for a cannula. I don't think most people would see 40,000 patients in their career, so you've got a 77% less risk with a cannula over a needle. So that tells you everything you need to know from the start. Is that this instrument it's not perfect. Don't get me wrong. It's not completely safe, but it's lower risk, and it's all about mitigating your risk. I think that's the thing with people starting off. If they get a problem or a complication early on in their career, in their fledgling career or their formative years of their development, they're very unlikely to carry on. They'll go back to their day job and say, you know what, this is not for me. So again, this is one of the reasons why understanding that complications are a part of normal life. Whatever job you do, there'll always be a complication, whether you drive a bus or whether you inject somebody's skin. There's always going to be an issue that's going to cause you and somebody else a little bit of distress. So again, having the ethics and the moral compass to train and to teach complications before we begin to inject is important, because one of the things about anatomy and complications, if you understand both, you can normally extrapolate backwards and normally work out the problem retrospectively. And again, for you, that makes you a little bit safer.
Absolutely. Man, this is great. Thank you so much for this, Lee. I really appreciate it. For anyone who hasn't picked up his book, this is the Injection Anatomy book, and it's amazing. I'm a huge fan, and it's in my bio, so if anybody wants to pick up a copy, you can just go to my bio, click there. You won't regret it. It's one of the best anatomy books specifically tailored to injections.
That's Dan doing the shameless plugging of that book and not me.
I'm serious. That's good.
No, as I say, it's a useful sort of addition to any Injectors library, and it's one of those things which heart and soul is in that book, and hopefully it'll be useful to most people.
Thanks so much.
You're welcome. Take care.
All right, take care.